Did you know that colon cancer is one of the leading causes of cancer-related deaths worldwide? But what many people may not realize is that this type of cancer can be detected early, significantly increasing the chances of successful treatment. However, it is crucial to be aware of early warning signs. That's why I ask you to watch this video until the end and pay close attention to every detail. Our goal is to unveil the key early warning signs of colon cancer that you should not ignore. This information can save lives, and understanding the importance of recognizing these signs can make a difference between life and death. So, don't waste any time, and let's together explore these crucial signs for your health. It's well known that a significant proportion of colon cancer cases occur in individuals aged 60 and older, with about half of the diagnoses being made in people over 65 years old. However, it's important to note that colon cancer is not restricted to the older age group, as it can also affect younger individuals. Furthermore, it's crucial to closely monitor bowel habits, as they can serve as early indicators of potential colon issues. A healthy colon typically exhibits a regular pattern of bowel movements, characterized by 1 or 2 evacuations a day, with soft, brown-colored stools and no presence of blood. Any deviation from this pattern, such as decreased frequency or changes in stool consistency, should be thoroughly investigated. As for diarrhea, it's a common symptom among patients diagnosed with colon cancer. Technically, diarrhea is defined as 3 or more bowel movements of loose or watery stools within a 24-hour period. However, it's important to emphasize that diarrhea can be caused by a variety of conditions, not limited to cancer. Irritable bowel syndrome, lactose intolerance, inflammatory bowel disease, and bacterial or parasitic infections can also trigger this symptom. Let's now disagree about constipation, which ranks 3rd on the list of indicative signs of colon dysfunction. The colon, aside from eliminating waste from the body, plays a crucial role in absorbing water and nutrients from ingested food. However, in some situations, it can encounter obstructions, resembling a traffic jam, resulting in constipation. It's important to emphasize that constipation is not merely a bathroom inconvenience. It can actually serve as an early sign of more serious problems. Surprisingly, over 80% of people with colon cancer have reported experiencing constipation before diagnosis. This condition can be triggered by various factors, such as medication side effects or lack of physical activity. Distinguishing between common constipation and a warning sign for colon cancer may be necessary. Therefore, if you notice that you're experiencing this condition for more than 3 consecutive days, it's advisable to consult a doctor, especially if other symptoms are present, such as blood in the stool or abdominal pain. And I'd like to remind you that if you're enjoying our content so far, don't forget to leave your like and subscribe to our channel to stay updated on all our latest releases. Let's now address the 4th item on our list, blood in the stool. It's important to understand that colon cancer has a hereditary predisposition, and the earlier it's detected, the higher the chances of survival. In fact, a 5-year survival rate can reach an incredible 95%. However, the reality is that 1 in every 20 Americans will face this challenge at some point in their lives. So, the sooner we identify it, the better. The presence of blood in the stool can be an early warning sign of colon cancer. The colon, an essential part of the digestive system, is responsible for storing feces before elimination. When we observe blood in the stool, various causes may be involved, not limited solely to cancer. Conditions such as ulcerative colitis, diverticulitis, and even hemorrhoids can cause this symptom. Typically, bleeding occurs due to lesions in the large intestine, although it can also originate from other parts of the digestive system, such as stomach ulcers. Additionally, certain medications, such as antibiotics or iron supplements, can also trigger this issue. So, are you enjoying our conversation about colon cancer so far? We'll continue with more important information, and don't forget to share this knowledge with your friends and family. Let's now address the 5th item on our list, rectal bleeding. When we notice this type of bleeding, it's important to consider it as a warning sign for colon cancer. The rectum is the final portion of our large intestine, approximately 8 centimeters in length and it's where waste is expelled from the body. However, it's important to highlight that rectal bleeding is a relatively common occurrence, and not all individuals experiencing this symptom are presented with colon cancer. Other conditions, such as hemorrhoids or anal fissures, may be responsible for this bleeding. Additionally, it's worth mentioning that the presence of a polyp or other growth on the surface of the colon can also be a potential cause of this type of bleeding. Now, let's discuss the sixth item on our list: unexplained bloating or abdominal pain. Colon cancer can have various origins, from genetic factors to lifestyle choices, such as our diet and activity patterns. Did you know that these habits can increase the risk of developing cancer by up to 30%? Genetics also play a significant role, contributing to about 10 to 15% of cases. Returning to the topic, abdominal bloating is one of the most common symptoms of colon cancer. It can manifest early in the disease or result from other unrelated conditions. Have you ever experienced that feeling of a somewhat full, bloated belly? It's more or less like that. Sometimes it's just due to gas, but it can also be triggered by certain foods or medications we consume. If you notice that your belly becomes bloated after meals, a tip is to try eating smaller portions more frequently throughout the day rather than having 3 large meals. This not only helps avoid discomfort caused by overeating, but also keeps blood sugar levels more stable. So, are you enjoying this conversation? Stick with us, as we still have more valuable information about colon cancer to share. And don't forget to pass on these tips to those you care about. The 7th point on our list is feeling constantly tired. You know, the symptoms of colon cancer often manifest gradually, without presenting very obvious warning signs. And fatigue, let's be honest, is quite common, isn't it? It can be attributed to various reasons, such as staying up late or not getting adequate sleep. However, if you find yourself experiencing more intense fatigue than usual and it doesn't improve even after a period of proper rest, it may be a sign that something isn't functioning correctly in your body. The colon plays a crucial role in our digestive system, responsible for eliminating waste from the body through feces. If this process encounters any obstruction or slows down, it can result in the buildup of toxins in our digestive system. And if this condition persists for a long period, it may even give rise to cancerous tumors on the colon wall. Therefore, if you're frequently tired and don't notice other associated symptoms, such as abdominal bloating or pain, it's important to consider it as a warning sign that something may not be going well in the colon. The 8th item on our list is sudden weight loss. The symptoms of colon cancer can vary depending on the location of the tumor and its stage. However, experiencing sudden weight loss can be an early sign of both colon cancer and other gastrointestinal diseases. It's crucial to emphasize that there are other possible reasons for weight loss, right? Especially if you're older and have recently gone through an illness. In those situations, it's even expected to shed a few extra pounds. However, if you've lost more than 10 or 15 pounds over several months without a clear explanation, it's important to pay attention, as it could be a warning sign for colon cancer. So folks, are you following along all right? We still have one more important sign to discuss, so stay with us. Let's now explore the 9th important sign. Another sign deserving attention is feeling constantly full. We all know that maintaining a healthy diet can reduce the risk of developing colon cancer, but sometimes that's not enough to prevent the disease. Physical exercise also plays a crucial role in this journey of maintaining health. Now, if you constantly feel full, even when you haven't eaten much, it could indicate that something isn't right in your digestive system. Colon cancer can cause abdominal bloating, constipation, diarrhea, and other digestive issues that make normal eating a challenging task. It's important to remember that these symptoms often start subtly and can be easily ignored or dismissed, especially if you're already dealing with other problems like weight loss or fatigue. Regardless of your age, it's essential to adopt a healthy lifestyle with a balanced diet, regular physical activity, and maintaining a proper weight to ensure colon health. Additionally, if you have a first-degree relative who was diagnosed with colorectal cancer before the age of 55, or if you have 2 relatives with such a history, your risk of developing the disease is higher than average. It's worth noting that African Americans have a higher risk of colon cancer compared to other races and ethnicities in the U.S. Always remember, if you experience any of the discussed symptoms, don't hesitate to contact your doctor. These symptoms may be early signs of colon cancer, but they're not conclusive. And if you have additional risk factors, such as a family history of the disease, talk to your doctor about the possibility of undergoing a colonoscopy for screening. I appreciate everyone who took the time to watch this video and learn more about the early warning signs of colon cancer. Remember that the knowledge shared here can make all the difference in early detection and effective treatment of this disease. By sharing this video with your friends and family, you'll help raise awareness about the importance of being attentive to colon cancer signs. Together, we can make a difference in the prevention and fight against this disease. Don't forget to watch the next video that will appear on the screen, as we'll continue to bring valuable information for your health. Thank you for watching and for helping spread this important message.